get started, I think there was one person just checking in down below. Excuse me for my informal clothing, but I know we're going to be doing some work today that requires something other than my dress that I just had on for another business meeting. My name is Dawn Fern, and I'm director of Samaritan Regional Cancer Center. Come on in. And I want to welcome all of you here today. We're very happy to have you. I'm very excited about this joint effort between the Integrative Medicine Department in Heart Springs and the Cancer Center in sponsoring this. Whether you're a caregiver, a family member, or somebody who has personally had cancer, I welcome you. Not only has therapy been my whole life, but I'm also a survivor of cancer myself. And so I'm really looking forward to this opportunity to have these different experiences. My own experience was almost 20 years ago, and so I think I have moved beyond cancer, but I couldn't have done it without a lot of support and a lot of really wonderful ideas, which is what this is about. So with that, I'm going to turn this over to our keynote speaker, Dr. Marianne Wallace, who is Director of Integrative Medicine. And I'll leave it with that. You'll do a better job than I can, so thank you for coming.
Thank you, Dawn.
You're welcome.
What's very funny about this is Dawn asked me 2 seconds ago whether I would like her to introduce me, and I had all prepared to introduce her and thank the Regional Cancer Center for even making this possible. I'm actually the medical director of Heart Spring Wellness Center, and Dawn and I have been in conversation for quite a number of months about how to put something together that goes beyond just allopathic medicine for people with cancer and other chronic diseases, and also people who take care of patients who want to learn about a few more alternatives and a few more ways of looking at life and disease than just the kind of pathological allopathic method that many of us are familiar with. So on that note, I am curious to know how many of you have ever had a life-altering, doesn't have to be life-threatening, but a life-altering disease, or have been closely associated with someone who has. All right, wow. I wish you should have all looked around. I don't think there were any exceptions. So in that case, you're going to know everything I'm talking about. I'm going to be speaking the obvious to those of us who have ever had a life-altering disease. We know good and well that Mindbody medicine has something to offer. And I want to talk first of all about what is Mindbody medicine, because I get asked that question a lot. You know, for people who haven't really had the experience of tuning into more than just their body, that's a common question. And the first thing I'd like to do is talk about what it is not. And the reason for that is that there are so many variations on this theme, some of which are a little bit unkind. And so one of the things that Mindbody medicine is not is it is not simply mind over matter. And the reason I want to emphasize that is that one of the sort of new age unkindnesses that I hear sometimes is, can you all hear me, by the way? I have a quiet voice. Can you hear me okay?
Could be a little bit louder.
Could it be a little bit louder? Is this control? I don't have a microphone on. This is just a recorder. All right. Okay. The reason that I want to focus on it is not just mind over matter is there's kind of a new age cruelty that I hear sometimes that implies that if only you had your mental act together, you wouldn't be having this physical problem. You know, everybody's nodding. And doesn't it feel like a jab? And don't you just feel like saying something? I'm on camera. I can't tell you what I felt like saying when I've yeah.
I can.
So that's not what that is. That's not what mind-body medicine is about. It's not that simple. It also is not a statement that you've done something wrong in your life. So if you could just figure out some major element, that everything would be peachy keen. And it also, very specifically, does not mean that everything is in your head. You know, you've all been there too. You go to the doctor and there's not necessarily a clean, clear diagnosis or a clean, clear pathological understanding about the symptoms you're having, and so the automatic assumption is it's in your head. And you know good and well you're feeling it. And it's not just in your head where you've got the sensation. So I want very much to emphasize that this is not what mind-body medicine is about. So what is it? Well, I've alluded to a couple of things. And any of us who've had a life-altering disease, or particularly life-threatening disease, knows this. Mind-body medicine is nested, housed on the premise and with the understanding that we are more than our body. We are more than our body. So when we have a life-altering disease or experience or crisis or any experience in life, it is more than our body that is having that experience. It's more complicated than just physical ailment with physical explanation. And as soon as you start to buy into that, which is almost a self-evident statement, isn't it? It's sort of, duh, well, okay. But you see, this is profound. And any of us who have had a life-altering disease knows this. You have the experience of kind of walking along, tootling along, doing your life, right? And isn't it funny? We identify ourselves in very many different ways. We identify ourselves by our name, by our appearance. We look in the mirror and, okay, we might carry on about the new gray hair and the new wrinkle, but it's sort of gradual, these changes we go through. And we have time to get used to them. We look in the mirror and it's reassuring. It's the same person that was there yesterday. We identify ourselves by the work we do, by our careers, by our relationships. So I'm not just Jane. I'm Jane, a nurse who works in the hospital, who's a wife and a mother of Joe. And this is how we identify ourselves. And the thing that a life-altering disease does is it takes you out of that track and takes away a whole bunch of your identifiers. How many of you had that experience? Yes. And so you're tootling along doing life, and all of a sudden, the track, we have this trajectory that we call the future. We expect the future to be a certain way based upon ourselves right now, based upon these definitions of ourselves. So it's as if a life-altering disease, particularly life-threatening disease, picks us up and puts us in a different track. What do we do with that? This is scary business then, because what's ahead of us is a complete unknown. It's an abyss. Because if our definition of ourselves as we've been to this moment is ripped away, then what do we do? Now, people go through different phases about this. I studied with Elizabeth Kubler-Ross back in the 70s. I'm sure many of you are familiar with her work. And the first phase that we talk about is denial. Now, I have some variations of it based upon my experience. I happen to agree with, in my experience, the first thing that tends to happen for most of us, though, is denial. And what I mean by that is the first thing we want more than anything is just to do life like we had it. Don't take it away already. I kind of like life the way I had it. Most of us at this stage of our lives have sort of secured ourselves in a niche in a way that we chose, that we wanted. And so we're not too friendly about the idea of it being ripped away. So denial empowers us with a little extra energy to keep things together a little bit longer. And then, over time, what happens, either because of the pain level, or the weight loss, or the nausea, or the whatever symptoms, the fatigue, whatever it is, at some point, our ability to hold it together just the way it was dissolves. And then where we're left is really in that abyss of, well, all right, then who am I without who I thought I was? So at that moment, you see, that's a whole life experience. That's not just your body that has the disease. If you have cancer, it's not just your body that has cancer. It's your whole life. It's every part of you. And so, in a funny kind of a way, or a strange way, in that moment, disease actually becomes a teacher. And what I mean by that is that it forces us into a place where we have to ask ourselves some questions that we didn't necessarily come to before this moment in time. I know in my life, I can remember distinctly sitting on the bedroom floor and staring at my hands, which were so swollen I couldn't get my ring beyond my fingernail, and the ends were broken open and bleeding, and I was so cold. I was aware my bone marrow was not working. And I realized I really, really, really got that I had 1, maybe 2 months left to live. And I really got it. And I'd always prided myself on being ready to die, but not like that, and not now. I'm too young. And I was pissed. I was so not ready. And I looked in the mirror, and man, I didn't like what I knew was going to happen. I'm not ready yet. So I was upset for a few days. And then one night I woke up, and I just really got in that second that, well, so I have a month to live. So what am I going to do? What am I going to do? If I can't do that, what am I going to do? What do I care about? What matters more to me? And this is what the disease does as a teacher. It makes us ask ourselves, what matters most? You got 1 inch instead of 10 miles of energy? How are you going to use it? So when we get ripped away all these pieces of ourselves that explain who we are, we're left with this sort of naked state where there's us and this raw state where we really don't know, and we have to find out. We have to ask ourselves. And what I ask myself, the thing that really was huge is this life is so precious. It's so precious. You know, and if it's 1 month or 30 years, who cares? If I keep doing what I was doing, which is what everybody else wanted me to do, it wasn't my life anyway. So who cares? So I made a commitment that I have stuck to more or less since then. And this is my life I'm leading. The fact that I'm up here now talking to you, this is my choice, because this is what matters. I just got that, you know, all the physiological medicine that it's not that that doesn't matter, so please don't misunderstand this either. This is a part of the whole picture. It's all part of the big picture. So this is not about don't get physical healing. I don't mean that. I think you all know this. But when you get right down to the precious, raw, rareness of your life, do you know there is not one single person on the planet or the universe, as far as we know, who can do what you can do? Not one. You, only you, can do what you are equipped to do. And this is what disease can do when we open up. Now, I want to say something. One of the big phases that most people go through, and this is what I would call the second phase, is we identify with our disease for a while. And I want to emphasize this because if any of you are in that state, this is a normal thing. It makes complete sense. I mean, if the disease comes along and it rips away everything that you thought you were, then what are you left with? The disease defines how much energy you have, what you can do with your life, who you can see, who you can spend time with, how many hours in the day you really have that are functional, you know, when you have to take your medicine. If you've had chemotherapy, it defines when you can even go out of the house. So for a while, the disease is really big, and the disease defines who you are. This is a normal thing. This is to be expected. Of course it is. Because, you know, it has taken over. So you feel very out of control, and suddenly the disease is running your life. Well, the good news in this is that just as you are more than your body, you are also more than your disease. You are more than your disease. You're having an experience with a disease. The disease is not you. And it's very important to know this. It's very important to really get this, because it really can feel like the disease takes over and defines who we are. So we relate to, you know, hi, I'm Jane, I'm a cancer person. Well, you have this experience, but the experience is not you either. This experience, if you can open to it in this way, drives you right into the question of who am I and what am I capable of if I'm not who I was. I want so much for that to be the understanding. Another premise of mind-body medicine is that you're in charge of your health. Now, what I mean by that, please do not misunderstand this either. It isn't, okay, then get better. No, of course not. What I mean by that is that deeper part of you, that, call it soul, call it spirit, call it whatever you want, but that part of you that is still alive, still living, when everything else that you thought that you were is gone, that part of you that is continuous in this, is in charge. And sometimes the lessons or the stuff or the experiences we have are, basic crap. And that's on film. They're not pleasant at all. But how else? It's really a crisis, isn't it, that throws us into the fullness of our capability. It really is. Greg Lavoie wrote a great book, actually, which I recommend. It's called Callings. And he said, one of the shining qualities that heroes possess is the willingness to be educated by all things. And he talked about a woman by the name of Kat Duff, who was a successful counselor. She had quite a booming business, as I understood the story, and she was perfectly happy with her life. And she had had a particularly grueling counseling session and went home, and as she tells the story, she fell into bed exhausted and was so exhausted that she couldn't function. And a number of tests and a number of physicians later, she was given the diagnosis of chronic fatigue immune dysfunction disorder. And she was confined to bed for 2 years. And during this time, she started writing. And she tells the story that it was as if writing caused a dam to open up inside of her. And she discovered facets of herself she had no idea about. And she, in fact, wrote a book called The Alchemy of Illness, which chronicled her disease. And what she said is, my illness midwifed the writer in me. I think it was ready to come forward, and the illness was just about the only way life could get me to honor, receive, and assume that part of myself. So, to the extent that we can bring ourselves into that place and say, all right, I did nothing wrong to be here. This is not about mind over matter. But here I am. This is the spot I am right now. And this is probably the biggest adversary and the hardest situation I've ever had, and much worse than I could have imagined. And so what am I going to do with it now? What in my relationships am I going to open up to? What inside of myself that is hurting am I going to open up to and be kind to? What in me can blossom out of this? And to the extent that we can do that, you will be living the principles of mind-body medicine, which encourages us to look at every facet of ourselves, which encourages us to use every situation as an opportunity to explore more deeply what we're capable of, given this hardship or this whatever. And what we've put together today for you as this seminar is a number of different workshops, each of which are put on by people who are experts in their field and whose focus will be to help nourish all parts of you and give you the room, the sort of inner resources to ask some of these deeper questions. And so I truly hope that you will enjoy today. I have a few more things. Do you have questions? I wanted to leave a couple of minutes for questions or comments every one of you have experienced, so you all raised your hand.
Oh, my problem is, I look at things with a different eyes now, but everybody around me is still doing the same song and dance.
Yes.
Family members, and that's the hardest part. You're
Yes.
like,
Yes.
hello, people. Wasn't
Yes.
this enough between cancer and 9/11? Let's,
Yes.
go on this change
Yes.
with me, but nobody wants to go with me.
Yes. That's a good thing. Could you all
comment? I mean, it's not really a question.
May I comment on it?
Sure.
Did you all hear what she said? Yeah, this is a common thing, and a survivor of anything, shipwreck, the war, any residency, any one of us who have gone through an exquisitely painful or life-altering experience, I mean, that's exactly right, because here you are, and you're not part of the McDonald's crowd anymore. The mall scene, the norm. Any one of us who are stepping out of tune or out of step with all the norm that has been going on are subject to being misunderstood, and people could only hear in the decibel range that they're capable of hearing. And I would ask each of you to say, well, if this hadn't happened, then would you have questioned that either? You see? And so then over time, what that creates is a seed for great compassion. A seed for great compassion. This is not to rush the river here and say, oh, well, you ought to be there. No, good grief almighty. We have to go through the process, but that is where compassion grows from. When we've been broken open and revealed to ourselves to not be who we thought we were, and nobody else gets it, then we learn a certain fortitude. Now, in my case, I didn't finish my story. Amazingly, after I came to that commitment over a 2.5-week period, my symptoms all went away. So that's a miracle as far as I'm concerned. So that's not a guarantee. I don't know the outcome. For every single person, the experience is different, the outcome is different, but I do know that these strong experiences give us the opportunity to ask these questions and come to grips with them. And then sometimes, frankly, our life is done. And it's time to go on to other things. But if we continue living, to the extent that we can embody the kernel of what we've learned, and relate it around, and realize that nobody who hasn't been through the fire knows what it feels like. You can talk about the fire, right? You can describe it. You can do the colors. You can talk about the sensations. You can do all of it. But you don't know fire until your hand's been in it. So you're uniquely qualified here. You are in an experience that no other person can understand, and it's besides the point. It's cracked you open. And then you say, all right, I will define now who I am. I will accept as deeply as I'm capable who I am, and then I'll go out in the world and I'll do my thing as best I can. And then you do that. And you find other people who are ready and willing and want to hear this message. Yes? I'm very grateful that you're here.